Are you a woman in healthcare and you have student loans? You may be thinking to yourself, how am I going to pay this off? And do I actually need to make a payment? Well, welcome to this video. I am your wealth coach, Dr. Brittany Helford, internal medicine physician and wealth coach for women in healthcare. And I have good news for you. I paid off $138,000 in 2 years and 9 months. So you are in good company for some good, juicy advice. No gatekeeping here. Now, as we learn in medicine, we talk about case scenarios. So in this YouTube video, I'm going to give you a few case scenarios and you can see which of these women in healthcare may align with your identity, align with your financial profile and your student loan profile, and really draw some inspiration and some guidance on what your next steps are. When you're thinking about your student loans, you really have to incorporate strategy. And a lot of times, and if you're anything like I was in residency, I just figured I had to pay what was told to me. But that's really not the case. Now that I've educated myself, I have helped numerous women to pay down credit card debt and get student loan debt forgiveness and pay down their student loans. So you can create a strategy that works for you, that aligns with your financial goals, the lifestyle that you desire, and to make sure that you're using your money for what matters most to you, to create a life of fulfillment and joy. I mean, you worked a long time for those student loans and for that degree, right? You should start to enjoy it. The first step in any debt payoff strategy, regardless if it's credit card debt or student loan debt, is to really familiarize yourself with your debt. Because if you don't know your numbers, you don't know who your loan servicer is, if you don't know the interest rates, the amounts, how can you be strategic? No strategy comes from misinformation. And so it is imperative that you start to collect those documents, print them out if you need to, create a folder on your desktop to really start to organize all of that information so that you can create a strategy. Now, you may be thinking, well, I don't even know where to start. And you can go to studentaid.gov and create a profile, and that should bring up most of your federal student loan information. You may have some private loans, and therefore you should reach out to that servicer to get information on what your interest payments are. Is this a fixed rate or a variable rate? What is the amount? And to understand the terms of that loan agreement so that you can decide whether you want to pay them off aggressively, whether you want to go for student loan forgiveness, or somewhere in between. The next thing you need to do is get consistent with your cash flow. The reason why is because if some months you have a negative $500 and some months you have a surplus of $500, it will be difficult to make a consistent student loan payment and to incorporate how much you want to strategize to reduce that payment or increase that payment so that you can reach your financial goals and experience the joy that you desire. So how you can do this is to get really consistent with your cash flow, is to create a budget. I know you're like, Brittany, I'm beyond budgeting. And let me tell you that nobody is beyond budgeting, because even though I've paid off all of my student loan debt, I still go through the process of reviewing our expenses, of creating a budget, of monitoring our accounts so that we can understand where our money is actually going. You cannot tell your money where to go if you have no clue where it is going. And I can tell you that money without a purpose, money without a direction is just going to go away because you're going to spend it. That's just how money works. We spend money. So you want to really understand, how are you currently utilizing your money? Is that serving you? How do you aspire to utilize your money? And create a budget plan that is going to work well for you. Now, if you're a woman in healthcare, you're like, all right, Dr. Helford, I get it. I need to know my information. I want to create a budget, but this sounds absolutely overwhelming. And then you're talking about strategy. Then I want to invite you to join my debt payoff course called Joyfully Free. Because even while paying off your student loans, you can have an experience debt freedom. You can create the life that you desire, and that's what I did, and that's what I teach my clients to do, and that's what I'm going to teach you in this course. As women in healthcare, I understand that we're busy. We don't have time in between taking care of ourselves, taking care of our families, and taking care of patients, which I want to say thank you for all that you do for healthcare and for caring for your patients, because I know firsthand that it is not an easy task, but we do it well and we make it look good. So I have distilled down to really those high yield facts and created all the spreadsheets, all the worksheets, so that you can get really, really strategic with your plan that helps you to reach that goal without having to Google and YouTube everything. So if you're interested, just go down to the description and click the link to explore more, or just send me a message right here on YouTube or on Instagram, and we can get the conversation started to see if this course is a really good fit for you. Now, back to the video. after you've created your budget and you really have worked that budget for about 3 months and can predict the outcome, that's when you can go and you can start to be strategic about your student loans, because now you have the information not only about your loans, you have the information about how much cash you have extra, and you can understand, do you want to pay that student loan amount? Does that sound good to you? Or do you want to modify that to accomplish your goals? That's the next step. You have to create a financial goal for not only your debt payoff, but what do you envision for the rest of your life? When you can create these aspirational goals and understand what is the trajectory that your life is going to navigate, that path that you want to create for yourself, it will help you to work backwards. There is an author that I really like his book, Stephen Covey, and he talks about beginning with the end in mind. So when you're thinking about your financial goals, you want to start with that vision, so therefore you can work backwards. Let me give you an example. I had a client who was paying her student loans as dictated by her student loan servicer. She had no vision of forgiveness, and she continued to struggle with paying her student loans, her car loan, her credit card debt. And after meeting, we discussed forgiveness. Is this an option for you? Is this something that you desire? And she's basically said, Brittany, I had never thought about this. After delving deep into her history, we realized that she had always worked for a nonprofit, and therefore she was able to take advantage of the public service loan forgiveness waiver, and she got $70K forgiven. Now, just imagine that she had started knowing that she was going for forgiveness, and with that goal in mind, she adjusted her money moves, she adjusted her strategy so that she would pay the least amount over time and would get the most amount forgiven. The name of the game is paying the least amount over time, and you can accomplish that goal in many ways. So make sure you think about, do I actually want student loan forgiveness? Is that an option for me currently? And if not, how can I adjust my strategy so that that can become an option for me in my future if this is something that you desire? Now that you've gathered your information, you've gotten consistent with your cash flow, you have considered your financial goals, now it's time for you to pick a repayment plan. This is really what everyone wants to know. Should I do the SAVE plan? Do I qualify for pay as you earn? Should I refinance my student loans? And all of those could be viable options depending on your financial profile, depending on how much money you have, depending on what financial goals you have. Now, I'm going to teach you about various plans, give you some case scenarios to see if they might work best for you. Because what looks good for someone else and works for someone else may not work for you. And in fact, this is the most common pitfall that I see us women in healthcare falling into. Is because we often have conversations with our colleagues and have recommendations, and so we think that that recommendation is what's going to work for us. We adopt that plan only to realize that it doesn't align with our goals, our visions, our cash flow, and unfortunately sometimes we have to pay for it. So I don't want that to happen to you. So if you kind of tuned out, come back to this video because I'm about to give you the good stuff. Let's take our first scenario. This is Maggie, and she is a resident physician. She just graduated from, let's say, Michigan Medical School, the University of Michigan Medical School. I went to undergrad there, but go blue. And she now has $131,000 of student loan debt. In considering her plan, she doesn't really know if she wants to go for forgiveness or if she wants to pay them off aggressively. But what she knows right now is that if she were to pay them off, she wouldn't be able to afford a monthly payment of $1,000 because as a resident physician, you don't make that much money. More than 50% of Americans, but not that much money compared to what you will make as an attending physician. So for Maggie, our resident physician, she decides to enroll in an income-driven repayment option, the SAVE plan, saving for a valuable education, because she gets the 100% interest subsidy, and she also gets the higher 225% poverty federal line deduction, which will help her to lower her payments even further. Now she's wondering if she should recertify or not, and she technically has never paid on student loans and has not submitted any documentation for her student loans. She knows that her employer qualifies for the public service loan forgiveness because it is a 503c, and she submits the employer certification, enrolls in the SAVE plan, and continues on making very little payments. Now you may ask, when do I actually recertify? And if you never worked in 2023 and you don't have any income to show, then that will work in your favor. So you can submit your 2023 tax return as the verification for your income and make $0 payments for this 6-month period. Maggie feels like she's a winner because she is, and now she has a 0 payment. She can understand her cash flow a little bit better in preparation for next year and be really strategic about how she wants to plan her finances for the upcoming year. All right, did you learn anything? Did you identify with Maggie? Maybe you are a resident. Perhaps you're not. So let me give you a few more scenarios to really clarify this for you. Next, we have Lauren. She just became a nurse anesthetist and she's really enjoying her new career. Now, she's looked up her student loan information on studentaid.gov and did an evaluation of the student loan plans. And unfortunately, because her high income, the SAVE plan is not really a good option for her. She really doesn't know what to do because she doesn't want to pay such a large amount of student loans over 10 years in the standard repayment option. So Lauren looks at her numbers, evaluates her cash flow, and she starts to consider, will refinancing actually work for me? She applies to a few companies and she's able to negotiate her rates. And in fact, she was able to lower her rate lower than the standard repayment and still get a really good interest rate. So Lauren's like, forget it, I'm just gonna pay back these loans and do refinancing, and she is living her best life. Now, keeping your loans and federal loans under an income-driven repayment option may not be the best move for you. I know it wasn't for me, and clearly it's not the case for Lauren either. So when you're thinking about, should I refinance or should I keep my loans federal, it really depends on, have you gotten consistent with that cash flow? What are your payment options, the amount, how does that feel for you? How can you accomplish your other goals and make a best decision upon those factors? Next, we have Kelly. She is a nurse who really loves taking care of patients, but she works for a private hospital. She graduated just before the pandemic and has never actually had to pay her student loan. So in evaluating her plans, the SAVE plan actually increases her payment more than the standard repayment option because she's earning such a great living working for this private company, and she really does not want to switch jobs. Knowing that she's not eligible for public service loan forgiveness, she reevaluates her goals, and paying her student loans for 2 decades just ain't cutting it. So she decides to enroll for the standard repayment option because when she does the refinance calculations, it really just does not work out for her. And she knows that she's still working on paying down some credit card debt, and she wants to have the security and the safety of keeping her loans federal just in case she has transitions in her life. So Kelly decides that she's gonna pay her loans back over 10 years under the standard repayment option, and that feels really good for her. She's able to still enjoy her life and her career, but has the comfort of knowing that if she has transitions, then she can always take advantage of the income-driven repayment options later on. So as you can see, no student loan plan is going to be a one-size-fits-all. And when you're creating your plan, you really want to make an informed decision, and you have to gather the information. Now, it is simple to create a strategy, but you cannot create a strategy if you don't understand how to play the game. So that is what I will be giving you in Joyfully Free. You don't have to spend time Googling because I know your time is so valuable. Why waste the time looking information up when you can just have the information and start doing instead of doing the research to understand how you should implement a plan? I teach you everything you need to know. You can put me in your ears, listen to me like a podcast. I give you all the spreadsheets with all the calculations and the automations so that you don't have to start to put the formulas together. You can just put the numbers, get the information, and use that information to create a strategy. Literally, with this course, you can have a debt payoff strategy in about 2 days if you really wanted to. So click the link and check out the course. If you have any questions, drop them down below in the comments or Instagram. I always like to have conversations with women in healthcare in the DMs. So whatever you do, I want you to know that you are worthy, that your work is valuable, and that you are deserving of a life of joy. All right, hit the subscribe button so you can get the next one. I'll see you there.